Hello and good afternoon to everyone joining us today, and welcome to the July edition of Foster Care Rates, Reimbursements, and Supplements. This is the Caregiver webinar series, and it is presented by California Department of Social Services in partnership with the California Alliance of Caregivers. We would like to welcome you today to joining us, and this is being recorded. I am Summer Rolfe, and I'm a program analyst from the Resource Family Support and Permanency branch at CDSS, and today I will be your facilitator. As I said, this webinar is being recorded, and it will be available later at www.caregiver.org/webinars. All of the handouts that are used today and the recording itself, as well as the webinar presentation slides, will all be mailed out to attendees. And if you would like a certificate for attending this webinar today, then please email your request to info@caregivers.org. And Jennifer, could you please place that in the chat for us? Participants will not be able to unmute themselves or speak with questions. So please, when you have questions, post them in the Q&A section of this webinar that's available. And at the end of the presentations, then we will facilitate the Q&A period. And next we have the agenda. So today, you are going to hear about the Caregiver Perspective. It's going to be presented by Jennifer Rexroad, who is the Executive Director of the California Alliance of Caregivers. Then you will hear a presentation about education and travel reimbursements by Jennifer Messerschmidt, who is with the Placement Services and Support branch at CDSS. And then you will hear a presentation about supplement rates presented by Ty Sparks, who's the manager, and Alicia Ward, who is an analyst, both with the Foster Care Rates and Policy Unit. After that, we will have the question and answer period, and this is going to be facilitated by Jennifer Rexroad. So at this time, I would like to hand this over to Jennifer Rexroad, and she is going to share the Caregiver's Perspective. So take it away, Jennifer.
Welcome, everyone. Thank you so much for joining us this afternoon. This webinar is part of a series, the Caregiver Support Webinar Series that we are partnering with the California Department of Social Services on to hear from our policy experts at the state on issues that directly affect caregivers and the youth in their care. And I just briefly wanted to share a story of how some of these policies directly affect youth and families. There is an education transportation reimbursement that you're going to hear more about from one of our panelists, Jennifer Messerschmidt. And this is a really critical type of support for families, because at the beginning of placement, if a caregiver knows that they have support to transport a youth to their school of origin, then the youth is far more likely to remain at their school of origin, and statistics show that their educational outcomes improve as a result of that. So they're able to keep more of their credits. They obviously get to stay with their friends and teachers who are part of their support system and community. And so we really want caregivers to understand the support that's available to them so that they can make decisions that are in the best interest of their youth and their children and youth. So we thank you for attending today. We would love to hear any questions that you have, and you can go ahead and save those to the end or put those in the chat, and we will try to get all those questions answered for you. Thank you so much. And I will pass this back to you, Summer, to introduce our first panelist.
Thank you very much, Jennifer. I would now like to pass it over to Jennifer Messerschmidt with Education and Travel Reimbursements.
Okay. Hi, everybody. Welcome. This is Jennifer Messerschmidt with the California Department of Social Services. I'm an analyst with the Placement Services and Support team, mainly working on education, policies, procedures, and supports for foster youth. Today, I'm going to talk a little bit about the education travel reimbursement, why it's important, what the rates are, and who is eligible. Okay. So first we'll talk about why the travel reimbursement is so important, and it has to do with school stability and how important that is to our foster youth. Because on average, foster youth transfer schools on average 8 times while in foster care. And every time they transfer schools, it's like losing 4 to 6 months of learning. So as a result of that school instability, only 21% of foster youth are proficient in English by 11th grade and 6% in math. And fewer than 60% of our foster youth graduate from high school. And so it's important that we can change those statistics. And a big way we can change that is with keeping the child in their school of origin. And so what is the definition of school of origin? So when we're talking about the school of origin, it can include the school the youth attended at the time they entered the foster care or probation system. It could also be the school the youth most recently attended. So maybe when the child was removed from the home, they began a new school, and now they're changing placements again. So the school they're currently attending can also be their school of origin to try to decrease the amount of times they change schools. Or the school of origin could also be any school the youth attended in the past 15 months with which they have a connection. So having joined a sports team, having a relationship with friends and peers or teachers, just having a good after school program, different supports, a good counselor in their school, and they don't want to change schools to keep that stability. And then there's also feeder patterns with school of origin. So that means if the youth is transitioning from elementary school to middle school, are going from middle school to high school. The school of origin also includes the next school within the school district's feeder pattern so that they can move up to high school with all their peers. And there is school of origin dispute resolution. So if at any time there is a dispute regarding the youth's right to remain in a school of origin, the youth does have the right to remain in that school until the dispute is resolved and will need to be transported to that school. Disputes should be referred to the school district's dispute resolution process, and a complaint can be filed on the youth's behalf through the Uniform Complaint Procedures Act. And there is for your information in case you need to ever help a youth file a complaint. And so to help with this, keeping the kid in the school of origin, there is transportation funding. Many foster parents, including relatives, are eligible for funding from your local child protective agency. If you transport the youth to their school of origin after a placement change, and there is more information in our all county letters, and there is a link to a flyer I will be showing you in the future slide. And so under the Every Student Succeeds Act, School districts have to work with the child welfare agencies to ensure a youth is transported to their school of origin. Each school district's Title I plan has to include assurances that the district will collaborate with the state and local child welfare agency to develop and implement procedures for how transportation to school of origin will be provided. And so what are the mileage rates if you are transporting a child to their school of origin? So they measure from the distance from the foster care placement to the school of origin, the school you're transporting them, in miles one way. And so if you're transporting a child to the school that's within 3 miles from your home, there won't be any reimbursement. But once you start transporting a child to the school that's farther, that's 4 to 8 miles, then you can receive a reimbursement of $58 a month to help with that education travel. And then 9 to 13 miles would be $154 a month. 14 to 18 miles, $250 a month. And then 19 to 23 miles to the school of origin, $343 a month reimbursement. Or if you're transporting the child 24 or more miles, $443 a month to help take that child to the school of origin. And then you can also get travel reimbursement for public transportation if the youth is taking the bus. Educational travel rates may be paid for children taking any public transportation to their school of origin. Counties can purchase this transportation pass or reimburse the foster parents for purchasing these passes. Public transportation passes are reimbursed at flat rates of $25, $50, or $75 per month per youth, as determined by the placement agency. If the cost of the monthly public transportation fall between those two levels, and then reimbursement to the provider or a non-minor dependent will always be at the higher of the two levels. So if it's about $35 a month they're spending, you'll be getting the higher amount of $50 per month to go towards a public transportation pass. And so who is eligible for these travel education reimbursements? All the rates previously listed are to be paid to foster family home providers, and that includes licensed foster parents, approved relatives, certified foster parents, small family licenses, non-related extended family members, resource families, any of those for each foster child whose education stability plan indicates that the child will remain in their school of origin. And education travel reimbursement is for eligible youth in grades from kindergarten through 12th grade who return to their school of origin. The foster parent reimbursement payment allows for 4 one-way trips. So it is counting that you're doing 4 one-way trips, driving the foster child to school, driving back home, picking foster child up from school, and driving home. This payment would be for a 12-month period, and payment does not stop for any reason other than if there's a physical placement move for the child. This payment also requires transport for the child to extracurricular activities, parent-teacher conferences, and etc. So receiving this payment is also so the child can attend sports and other extracurricular activities, and to make sure you're able to attend parent-teacher conferences, which is all very important for school stability. And so this is the flyer that I had a link to that you can refer back to or give to somebody that needs more information. It explains, again, who's eligible, what the mile rates are, about the public transportation rates. And of course, if you have any questions, you can contact your county social worker, or you can also contact me at the Placement Services and Support Unit. So some resources for caregivers. If you have any questions regarding the educational travel rates, you can also contact the Foster Care Rates Bureau or contact my unit, the Placement Services and Support Unit, and there's my phone number. And any education questions can always be emailed to fostercareeducation@dss.ca.gov. And some further resources about travel reimbursement and just other important education links and resources can be found at, the first one is the California Department of Social Services Foster Youth Education Resource Hub. that CDSS provides. And then we also have the California Department of Education. They have a foster youth services webpage. The Alliance for Children's Rights has very many different great resources, such as a resource family approval guide and toolkit, a foster youth education toolkit, and a education manual, the California Foster Youth Education Law Fact Sheets. And then there is links to all the foster youth education rights, the Foster Youth Services Coordinating Program, and the Foster Youth Local Education Agency Program contacts. So that's so you can look up who is assigned as the foster youth coordinator in your county and school district, and they can also help you with any education needs. And so thank you so much for joining and listening, and I hope this helps you support a foster youth in their education stability and keep them in their school of origin to improve their educational outcomes.
Thank you very much, Jennifer. And now I would like to pass things over to Ty Morgan and Alicia Ward to discuss supplemental rates.
Good afternoon, everyone. Let me share the PowerPoint.
Yeah, this is it.
Okay.
Okay.
Is it up? Can everybody see it? Okay, thank you. So as Summer said, I am Ty Starks Morgan, and I'm the manager of the Rates Policy Unit within CDSS. And with me today also is my staff, Alicia Ward, who will be handling some of those slides a little later on. Just a quick poll, if we can, indicate your category. Just put the letter in the chat, if you will, just so we have an idea of who's in the audience, and we would appreciate it. I'll give you about 30 seconds to do that. Okay, thank you. I actually can't see the chat, so it didn't help, but I appreciate it.
Mostly resource families
Thank you, Alicia.
and a few probation workers.
Awesome. Okay, so by way of introduction today, we are talking mostly about the Aid to Families with Dependent Children Foster Care Program. This is a federal program which provides benefits to children and non-minor dependents who are in out-of-home placement. If you haven't heard the term non-minor dependent before, that just means they were a foster child until they hit 18 and now they're over 18. The federal law is rather stringent, and there are some children and non-minors who don't end up qualifying for the federal law. So for those folks, we have a non-federal foster care program or other funding programs, which we will discuss a little bit later. If the CFC payments are made on behalf of a child or a non-minor dependent, just for your information, it's not income to the home-based caregiver, and it doesn't have to be claimed on your taxes, nor can a tax lien be placed against it. So our first rates that we'll talk about are the level of care rates. In 2018, this new home-based rate structure was implemented. It was at that time limited to new FFA placements only. I'm sorry, foster family agency placements only. And the LOCP requires social workers to assess the amount of care and supervision a child is receiving from the current caregiver within 60 days of placement into that home. But effective April 1st of this year, all new entries into foster care are eligible for the LOC-based structure, and any existing cases with a triggering event also became available. A triggering event includes a request from a provider, such as the majority of you folks, and that request can be based on changing needs. The child has developed or been diagnosed with a learning disability, a new medical issue, new behaviors, etc. Or a placement change would also trigger a new determination. Just quickly, who's not eligible for the new LOCP? That is emergency caregivers. Emergency caregivers are those homes that are taking a youth but are not yet an RFA. Once they become the RFA, then they would be eligible. Short-term residential therapeutic programs, that's the new fancy term for group homes. Supervised independent living placements, that is for our older children, 17 and above. And we'll talk a little bit about that later on. And non-related legal guardianships that were established in probate court as opposed to juvenile. The LOCP is basically an assessment matrix, and it's used by the social worker again to determine the level of care. The matrix can be found here at this hyperlink, which we will be sending this PowerPoint out to everyone in the group, or it's at the bottom of, I believe it's ACL 2160 on our web, 2161? Alicia, what's the number? 2160, I think.
2117.
Oh, wow, I was really wrong. Okay, it's on our website. And as a resource family, you should receive a copy of the completed matrix to just see what they've created you, so to speak. The matrix consists of 5 core domains: physical, educational, behavioral/emotional, health, and permanency/cultural. In just a minute, Alicia is going to discuss each of those. Once the matrix has been completed, you will end up with a rating, or the child will end up with a rating of LOC 1 through 4, or an intensive services foster care rate, which we will also discuss a little later. And now I'm going to hand it over to Alicia to discuss the matrix.
So as I mentioned, the matrix consists of 5 different domains. One is the physical domain, which includes daily living needs, such as helping the child with food, clothing, hygiene. This isn't the same as medical activities, which will be included in the health domain. This is more basic physical activities that a child or youth might need more help than would be expected for their age. Go ahead. So the next one, Ty. We have behavioral and emotional domain. So this is helping the child or youth with resilience and emotional well-being, encouraging the child or youth to engage in pro-social behaviors, as well as activities developing healthy relationships. This can also include taking the child to mental health appointments, and a rating of 7 will level the youth up to the intensive services foster care rate. Next is the educational domain, which is pretty much what it sounds like. It's just helping them out with homework, student achievement, responding to suspensions or expulsions if needed. Additionally, we wanted to point out that we did update it for the COVID-19 health crisis to make sure that this domain really applied to distance learning or virtual learning, as well as it did regular school. And we also have some stuff about preschool age children in there who attend early childhood education programs or youth that attend adult programs. So then we have the health domain. This is for those health activities such as medication administration, healthcare visits, medical, dental, monitoring and ensuring access to services that address special healthcare needs. And again, for this category, rating of 7 levels the youth up to the Isfc rate. And then lastly, we have the permanency and family services domain, which is kind of twofold. It's one, activities which are related to permanency, like visitation, communication, identification of family members, lifelong supports, connections, as well as connecting the youth with any sort of cultural or faith-based communities or organizations. So this is stuff like taking the youth to a church youth group or to a cultural center to connect with their sense of belonging, identity, and culture. I think you're on mute, Ty. Unless that's just me that can't hear.
Thank you. So just looking at the LOC rates, and just so you know, these rates are not effective until the governor signs the budget, which the last time I checked, he hadn't done yet. So they'll be effective any minute now. And you'll see the first line on the slide is what the resource family home would receive under each of those levels. And the second line is if you are with an FFA, what that FFA would receive. Okay, now we're going to move on to intensive services foster care. The ISFC rate is intended to accommodate children that have special health care or medical needs, or who are in therapeutic foster care or a similar type of placement. It's also a program that can be an alternative or a step down from a residential setting, such as a STRTP. The ISFC program gives the county or the agency some more flexibility to tailor the services to the individual needs of the child. And on the bottom left-hand side, you'll see that in an ISFC rate, the resource family gets $27.63 a month, and the FFA or the county will get an additional $36.82 for ISFC. ISFC has additional training requirements than a regular RFA. So you have your 12 hours of required training to become an RFA, and then there's another 28 hours on top of that. Those 28 hours should be made up of 18 hours in trauma-informed care or attachment interventions, and the other 10 hours can be electives that are related to the specific child that you'd be taking in. There's ongoing training every year after that, and a county or an FFA can require additional training or refresher training if they feel it's required. If you have additional questions about becoming an becoming an ISFC home, you can email the RFA mailbox that will be on the last slide. Now, as I said above, you have 60 days to complete the LOC when a child enters care, and normally during that time frame you would be receiving a basic rate until the LOC can be completed. But some kids come in and we know right away that they have additional needs that are going to require a higher rate. And so when that happens, we can pay what we're calling the static rate. Then that static rate is the same level as the ISFC rate, and it can be paid until that LOC is completed. Some of the static criteria, the static criteria are listed on this slide. I'm not going to read them all, but you can see, for example, that if somebody comes in with COVID-19, that it would be a reason to pay static criteria for extra care and supervision. The youth might need more medical doctor appointments, more medications, etc. Children coming in with special healthcare needs, maybe they've just had surgery or something. Those would be reasons to get the higher rate until the LOC can be done. Okay, now we're moving on to a new type of rate. This is the specialized care increment, and it's an additional payment to address the youth needs which go beyond the basic or level of care rates. These these plans are county specific, and not all counties participate. in a condition specified by one of the LOC levels may also warrant an additional SCI if the condition is severe enough. Some examples that we have in current SCI plans that would receive additional funding would be cerebral palsy, developmental delays, substance abuse, diabetes, truancy, specialized diet, and learning disabilities. Possibly the most important thing to know about specialized care is that it is the host county rate that is paid. So what happens a lot is their caretaker in LA is getting what they call the D rate in LA, which is their highest rate for their specialized care. And then they move to, say, San Bernardino County, and they're not going to get that anymore. So it is important to be aware that those are based upon the county in which you reside and will change if you move. We used to have all the plans on our website, but we recently had to take them down due to the fact that they're not accessible. So if you look on our website and the county you need is not there, you can email our SCI mailbox and we will send you the current plan. Just by way of information, we haven't talked about ARC yet, but we will in a minute. ARC youth are not eligible for SCI unless the county chooses to pay from their county-only funds. And also non-minors in a supervised independent living program are not eligible. And we will talk more about that in just a minute as well. Okay, our next rate is clothing allowance. Another one that is optional and varies by county. And unfortunately, since we did some funding realignment in 2011, a lot of counties have dropped it. But in those counties that still have it, it may be a one-time clothing allowance, an annual, a semi-annual, or even some as needed. But again, those are county specific and you would need to talk to someone in your county about that. So as I said at the beginning of this, the federal laws about who gets foster care are rather stringent. And in California, we don't pay our non-federal foster care program to relatives. And this resulted in sort of a unfair situation for children that were placed with relatives. So the department did create a program for relative caregivers. It's called ARC, Approved Relative Caregiver Funding. And so if the youth is living with an approved relative, they can receive the equivalent to a foster care payment. It just comes from a couple of different funding sources. But that should be virtually invisible to the provider. The other problem that we've had historically with relative providers is that they were traditionally unwilling to adopt because they didn't want to do a termination of parental rights for their relative. You know, a lot of grandmas didn't want to terminate their daughter or son's parental rights in order to adopt. So the department created the Kinship Guardianship Assistance Payment Program, it's a mouthful, KINGAP, whereby those children living with relatives can have a guardianship established and therefore exit foster care. The relative has all the rights that a parent would, like, you know, education decisions and medical decisions, etc. But they still get a foster care payment or the equivalent of a foster care payment in order to support those children. So the rate would be the same as what they were getting in foster care. And just for your information, it's not automatic. It's completely voluntary. After the child's been in foster care for 6 months, they can make the decision whether they want to move to that program or not. Another separate population that we have are called our dual agency children. These are children who are also consumers of regional center services. So they can be getting FC, AAP, KINGAP, ARC, etc., but they're also receiving services from a regional center for like a developmental disability. In these cases, the regional center is responsible for evaluating whether the foster child would be eligible for regional center services and for securing those services. for them. And in this case, DSS is responsible for payment for board and care of these children. The rate set for this population is in statute, and they're available to most, if not all, home-based foster care. So your resource families, your foster family agencies, children in a non-related legal guardianship, tribally approved home, licensed or approved foster home, or an approved relative / NEFRM. If the child's 3 and above, they may be eligible in addition to a supplement to the dual agency rate. These are the current rates. So a child up to 3 years of age can get $1,241 a month, which is higher than most of the LOC rates. And a child over 3 years gets the $2,771 a month. Plus, they can get up to a $1,000 a month supplement, which is that supplement, however, is completely at county discretion. Our next rate is the infant sup. So if you have, a 16-year-old living with you and they become pregnant, then they can continue to get their foster care payment. And once the baby's born, they'll get a $900 a month additional payment for, diapers and wipes and all those expensive things that babies have. And if you are willing to participate in a parenting support plan or a shared responsibility plan, then there's an additional $200 available per month. And it is important to note that this is parents of any gender who are eligible. There was a common misconception that this was only for moms. Our status supplement is for our funeral expenses. In the rare case where a foster child does die in care, the county can reimburse a funeral home for the cost of a funeral so that the foster parent can have, a fitting funeral for the child. And the last thing we're going to talk about today is our older kids. It's important to know that as the foster children in your care age, there are additional programs for them. So we have, and I believe it's from 16 and above, the Transitional Housing Placement Program. And there's separate programs. There's one for the 16 to 18-year-olds, and then there's the 18 and above. But essentially, they can live in sort of apartment-like housing. And I always think of it as they have sort of a dorm mother. There's an adult somewhere that can help them with anything they may need. And the legislature did just recently pass a housing supplement to that for those facilities that are in high rent areas like the Bay Area, where they get an additional amount to cover the cost there. And lastly, we have supervised independent living placements. As your youth get older and perhaps are going away to college, they can live independently, stay in a dorm, and still get their foster care payment for themselves so that they can cover their costs of, food and clothes and whatever else may come. If you have more questions about that area, there's the website there from the TAY policy, the Transitional Age Youth Policy unit that handles that information. And lastly, we have our contact information here. If you have a specific specialized care increment question, you're going to want to contact the county because, again, those vary from county to county. If you can't find the SCI coordinator in that county because you don't have the plan, then you can contact us and get the plan at that mailbox. LOC questions should go to our LOC mailbox. If you have any questions on the other rates, that's our rates policy general mailbox. And lastly, the RFA approval mailbox. And that is all we have for today. But we will take questions at the end.
Great. Thank you very much, Ty and Alicia. That was extremely informative and helpful. And I hope that it can help to add to the stability of placements as families that may not have been aware of all of the different supplements and allowances and rates that they're eligible for with different children. I hope that these families might consider expanding the different placements that they could accept into their homes now that they know that they would get additional support to help with the additional expenses. And at this point, we would like to move into the Q&A. So Jennifer Rexroad, if you'd please share the questions, and then either Jennifer can decide who she thinks would best be able to answer the question, or if someone else would like to speak, then they could go ahead. But let's be sure to keep ourselves on mute, panelists, if we are not the one talking. Otherwise, we can develop an echo. So thank you very much. And Jennifer, go ahead.
Thank you so much, Ty, and Jennifer and Alicia for all that information. There is a lot of helpful information in there. And so my first question is, my foster child was determined to be eligible for intensive services foster care. Can I receive the Isfc rate while I train to become an intensive services foster care approved home?
Yes,
And
I think it's up to 120 days. Is that I've got my staff on Skype. So yeah, they're all saying yes, 120 days.
okay, thank you.
Mm-hmm.
The next situation is my foster child is eligible for intensive services foster care, and they are already receiving wraparound or WRAP services. Can I receive the intensive services foster care rate if the child is getting WRAP services? And this can go to Ty or to Alicia, whoever wants to tackle that.
Yes, they can. But it is a little more complicated than just a yes, though. So we would recommend that you contact us at the rates policy or the IFC email, just to make sure. There were some questions in chat too. Are we going to answer those?
Jennifer, you're on mute.
Thanks. Okay, so somebody asked, is the new rate happening automatically? So I'm assuming they mean the level of care rate, the new with the level of care protocol.
All the rates that we posted today will happen automatically as soon as the governor signs the budget. They get a little bit of a COLA every year. We don't call it a COLA, we call it CNI, but it's essentially a COLA. But the amount of that COLA isn't official until the governor dots the I's. So as soon as he does, those will be the official rates.
Okay,
I thought that they meant does every case switch over to LOC automatically? Is that the question?
That's how I read it. And so the
okay.
answer may include that there's an assessment before their rate changes automatically.
There has to be, yeah, if it's an existing case, there has to be a triggering event for it to go into the LOC system. So whether that would be like the two triggering events or the parent requests it because maybe they've noticed, some new behaviors or whatever, or the child moves. So it will not be an automatic switch over to LOC.
Okay, and thank you. And another question is, how do you suggest caregivers find out what the specialized care increment is for their county, or if their county has one.
Easy. Check on our website. If it's not on our website, email us at the SCI mailbox and we will send it to you.
Okay, thank you. Somebody asked, can you compare the main differences between an ISFC home and a family approved to take a specialized needs youth?
No, I don't know what the latter one is. Is that something county specific?
Let's see. Whoever typed in that question, if you can send in some more information.
Do you mean a dual agency child?
That's what I'm thinking. Maybe a dual agency child. So if they were, it may be a county specific program.
If they're a dual agency child and also qualified for ISFC, then they would get whichever's higher, whichever rate is higher.
Okay.
Is what we've been talking to folks about.
Okay.
Ooh, $1,500. What is that?
So this is a good question. If the child has a level of care rate and SCI, and the county changes, so maybe that means a child moves jurisdiction to another county. Does that determination transfer to another county?
The LOC would, absolutely. As I said during the SCI presentation, those are county specific, so that would not transfer. But yeah, the LOC should. Now,
Okay.
I don't think just a new home would be a change in placement if the same caregiver is moving, but I'd have to think about that. But yeah, if the same caregiver just moves to a new home and takes the child with them, then the LOC should be able to go with them.
Okay. And somebody asked about training hours for the D rate and if they were going to be grandfathered in, I'm assuming, to the intensive services foster care. And I think those plans, at least as I understand them, are county specific, which of those training, yeah. So that would depend on the county.
Yes.
In the intensive services foster care program, if it's through an agency.
They need to ask somebody in LA County.
Somebody, let's see, my chat is jumping around here a little bit, so.
I saw a real quick and easy one. Somebody asked if probate guardianships, non-relative extended family members can receive SCI, and the answer is yes.
Oh, so you're saying for a probate but they wouldn't receive a probate guardianship, so an informal, so there wasn't a child welfare case, then would they receive the specialized care increment? Because they wouldn't be receiving a foster care payment.
Yeah, they would.
If they're a non-related extended family member, yeah, they would.
Oh, wait. Okay, let's
they
not
can't do
confuse our
LLCs.
terms.
But through ARC, not through.
No, okay, but you guys are confusing terms. Not a NEFRM. We're talking about a non-related legal guardian through probate court, Alicia.
Oh, the person put NEFRM in the question.
Oh, well, I saw one that said non-related legal guardian. So we must be looking at different questions. Okay.
And then somebody asked about the $1,500 stipend which was included in the budget that the governor is about to sign but hasn't signed yet. And so that is something that all the information is not out about that yet, but we're hopeful that for caregivers who that were caring for children during the pandemic last March 19th through June 15th. We are hoping that goes through, which it hasn't yet. Let me pull a few more questions from our, some more questions that we have here. I am a resource family approved by a county that does not have an Isfc program. Am I still able to receive the intensive services foster care rate?
Yeah, it was expanded to everyone April 1st. Even those counties that didn't previously have a program. So yeah, you would need to talk to your social worker about doing the LOC and seeing if the child's eligible.
Okay. And if a child or non-minor dependent is determined to be eligible for intensive services foster care, and I am unwilling or unable to become an approved intensive services foster care resource family, does the child need to change placements? And if not, what rate will I receive?
Actually, we discussed this just directly in our ACL, and they will get an LOC4, and the county and or FFA will be responsible to make sure the child gets all of the services that normally would be provided by the foster parent.
Okay, thanks. And are there any differences in rates or rate eligibility if a youth is a probation youth versus non-probation?
No, it's all one rate.
Okay. And I'm very happy that many of our probation partners have joined us today, because we hope that those youth can access this support as well. The next question is, what are the training requirements to become an intensive foster care approved resource family?
And all I can tell you is that it's 28 more hours. At 18 in trauma informed, and 10 in the electives. If you need anything more specific than that, you need to email the RFA mailbox.
Okay, thanks. Can an LOC rate be lowered if there is a triggering event?
Hang on, my staff, I can't remember, my staff is typing.
Well, it can be lowered from
Okay.
Isfc, but if it's LOC 2 through 4, it should not be lowered.
What she
Okay.
said.
Unless
And
there's a
are
placement change.
Okay. And are there any translations available for the level of care matrix?
You know, that's a funny question. We've been trying desperately to get it translated into Spanish, and because of all the new accessibility rules, we're having a hard time getting it done. So we do hope eventually it will be translated into Spanish. I don't think there's any plans to do it into anything else right now.
Okay. And what if a youth qualifies for intensive services foster care, but the county is not offering it?
I would check back with them since April, and hopefully they are going to be offering it, because everyone should be after April 1st.
Okay. And can they contact which unit at the state would they contact if they
They
need
can contact
some
us at the
technical
LOC
assistance?
mailbox
Okay.
or the
The level
Isfc
of,
mailbox, any of them. We
okay.
have 3 mailboxes in our unit.
So, and those mailboxes are the SCI, the LOC, and the ISFC mailboxes?
Exactly.
Okay, perfect.
The third one is the rates policy mailbox.
Right.
LOC,
Oh,
SCI,
sorry.
and rates policy.
Sorry.
Okay.
Thank you.
And again, all the slide deck and all these email addresses will be sent in a follow-up email. So everyone should have access to those emails.
All right, let's take a couple more questions. We have 3 more minutes. So can you guys choose questions that you feel like might reach the broadest audience? And then if anyone else still has questions that we didn't have a chance to answer, they can send the questions directly to the mailboxes that will be listed and sent out in the follow-up email with the slides. And let's make sure that if we're not speaking, that we're on mute. Thank you.
So there's a question about if a child resides in another county, which rate is used for the payment? So I'm guessing the placing in the residing counties are different.
Right. We always pay host county rate or even host state rate if it's out of state.
Okay. And let's see. So I just real quick, I think this is an important one. Somebody put in the chat that probation doesn't do LOC screening. They just get the basic rate. And what is your recommendation for that situation?
Well, again, April 1st, everyone became eligible. So I would check back with probation and see if they aren't doing it yet. I mean, I'm sure it took everyone a little while to implement. And we're only looking at, what, 2 months since it was implemented. And
So the caregiver should request that level of care assessment.
Mm-hmm.
Okay. Okay, Summer. I think we can wrap it up.
All right. Well, thank you very much for joining us today. And again, the various mailboxes will be sent out. I still see people asking questions about where they can get this information. And a lot of the slides also have informative links. Everything, all of the slides and information with the mailboxes and the contacts and everything will be sent out in a follow-up email. You will be able to access this webinar as well. And it is recorded and it will be accessible through a link. A transcription of this webinar is also available if you reach out to the mailbox at the bottom of the screen, kinship.care@dss.ca.gov. So thank you very much. Thank you to all the panelists, and thank you for everyone who attended today, and we look forward to seeing you next time.
I did just put our mailboxes in the chat as well.
Great, thank you.